Hey everyone, my name is Robbie, and today I'm going to be talking to you about my internship experience this summer at Lakeland Regional Health Grasslands Outpatient Physical Therapy Facility here in Lakeland and how it helped shape my perspective on my future career of physical therapy. So to start, um, what I really liked about this site was not that it was just one type of therapy all day, but that I got to see a multitude of patients, whether that be post-op, neuro, aquatic therapy, balance and vestibular, a great variety of cases, which helped me be engaged and interested throughout my time there. But in addition, when you really walk into the clinic, you see tons of treatment tables, machines, parallel bars, a neuro section, just different equipment. That is used depending on the patients that the different therapists are seeing. So, what really stood out to me the most was how each therapist, in their own way, treated and communicated with patients. Even if they had two different patients of the same diagnosis, the session could look completely different because every patient has different goals, personalities, and also limitations, and that's something that the therapists, have to adjust to. In addition, my role as a student worker within the clinic was similar to a rehab aide. Since I already had some experience working at LRH in their inpatient rehab facility, I feel that the team trusted me more and handed me more responsibility as a student worker. So a typical morning for me started with getting the clinic ready, and what that looked like would be stocking sheets, towels, linens, cleaning up treatment tables, cleaning up other equipment, making sure everything was ready before patients were to come in. So once the day got going, for example, I would bring a patient back, help get them started on warm-ups on the bikes, on some of the equipment, grabbing equipment for the therapists, helping clean the clinic, and just essentially helping the clinic move very smoothly and helping the flow of the clinic. Depending on the day, I would also shadow various therapists of my choice and ask questions when it was appropriate and be there whenever they needed me. So sometimes something small like grabbing a band or wiping down a machine, and other times being able to lead patients through exercises helped me feel like I was actually a part of the team and I was contributing more than just being an observer. So the best part of my experience was definitely being able to be independent and hands-on. So even as a student with the boundaries and the responsibilities that I had at a mature level, being amateur level, being able to help patients meant a lot. And some of the best moments for me were being able to use the goniometry skills that I developed in class, lead patients through exercises, observe evaluations one-on-one with therapists, and help them make real-time decisions. And I thought that was very cool because I wasn't just learning about PT through a textbook or through the classroom. I was seeing it happen again in real time. And I also felt like being there, being a second hand, I helped take some pressure off the therapist and help the flow of the clinic move much more smoothly and being a great help to the clinic. In addition, one of the biggest lessons that I've learned so far is that PT is a lot more psychological than it is physical. And what I mean by that is even though a patient might need movement and need strengthening in their body, um, there's also a psychological side to it too. And patients can feel scared and discouraged and frustrated, and they might not know what they need to improve. And of course, that's the patient's job, but many times they just need some motivation. They need someone to be patient with them, and they need someone to listen. So that really stood out to me because it showed me that being a therapist is not always knowing about anatomy, but it's knowing how to connect with someone and understanding them and communicating with them to allow them to be confident in their progress. So with that said, I feel like throughout the internship, I was able to build a lot of skills that I didn't fully understand that I had until I was in the clinic and that I was able to expand on. And one of the biggest ones was communication. And I've always seen myself as a social person, but this experience itself taught me that professional communication is more than just being able to talk to someone. It's being able to speak and listen and knowing how to read the room. So, in addition to that, clinical observation. Over time, I started paying more attention to why a therapist chose certain exercises, how they progressed, regressed the patient, and being able to add more tools to my toolbox. And another big area that I thought that I expanded on in my skill set was being professionally aware. In my evaluation, my science instructor reminded me that in an outpatient setting, other patients and staff may hear what's going on because there's multiple people around you. So being mindful of what's around you and what you say and what you do, that advice really stuck with me. Moving forward, the challenges that I faced during this internship, it's honestly hard because everything that I experienced here was very positive. But if I were to choose one thing, it would be my schedule. Being there from Monday through Friday, 8 a.m. to 12 was fun but difficult at the same time, given that many patients that come in the evening may face fatigue, confusion, or sundowning. And I think that's a side of care that I would have benefited being able to see because that's something that I would run into. And I feel like that is a big adjustment that many of the therapists have to do moving from the morning to the evening, given that they start their day and by the end of the day, the therapist also wants to go home. Another challenge that I saw was how insurance can affect physical therapy programming, and there are many patients that I ran into and that I worked with that were improving or still needed care, but their visits were limited, paused, and even stopped because of their insurance. So that was fairly frustrating because it led me to understand that healthcare is not always as simple as, a patient needing care and going to seek the care, but there's also an outside factor that affects the process, unfortunately. So with that said, this internship truly confirmed that I want to do physical therapy even more because even though I enjoy the movement and the things that we learn in undergrad and the things that we're going to learn in postgrad, but I really enjoyed the social aspect of it and the ability to be active and be creative and make the experience for the patients meaningful. So something that surprised me during my time here was how much I enjoyed working with the neuro team and the neurology population, and seeing how well I'd be able to contribute to this population, and seeing how hard these patients work for something small that may seem like something small to someone else, but it's something that is a huge improvement for them. Um, and then with that said, if I could give any advice to any future interns, I would tell them to be open-minded and ask questions and be willing to grow into this field. You never know what you might learn and what you might gain an interest for. So, with that said, the team at Grasslands made me feel very welcomed and very valued, and I was really grateful for this opportunity because it helped challenge me and give me confidence and reminded me why I wanted to be in this field. So, I thank you so much for this opportunity and thank you for listening.